Welcome back. While we try to brighten the mood and share a laugh here on Houston Life, we also know there are a lot of questions you might have at home about COVID-19.
Lots of information coming at us all the time. That's why we partnered with Texas Children's Hospital to make sure you get the answers you need and stay updated on what they're doing to help fight this disease.
And here to share with us how they're preparing is Dr. Amy Arrington, Medical Director of the Special Isolation Unit at Texas Children's Hospital West Campus. Dr. Arrington, welcome to the show. First of all, tell us about the Special Isolation Unit. What exactly is that?
Sure. So this is a very specialized pediatric unit that we built back in 2015. And the stimulus at that time was the unprecedented Ebola outbreak that was occurring. And so we felt as an organization that we needed to be prepared at all times to take any child with a highly infectious disease, whether that be Ebola or SARS or MERS or now COVID-19. So the unit is a true biocontainment unit capable of full special isolation of patients. The unit itself is 8 beds, and we can expand that if needed out to 18 beds. And the unit has very special things in it that make it a true biocontainment unit. So it's all negative pressure, which means that the airflow is specific so that your airflow is coming into the room and out the top and ventilating. There's HEPA filtration. We have a very specialized bio-level 3 lab that's located within the unit. We have the capability of incinerating our own highly infectious waste and trash, and that's done within the unit itself. So it's a very special unit. It's a one-of-a-kind unit within Texas and the Southwest region. And there are a few now around the United States that are specifically for children, but we're one of the larger ones.
It's really incredible to hear what's going on in that unit and how it was built in 2015 for other viruses. Of course, with COVID-19, I feel like we are learning more and more new things about this virus on a daily basis. And if you can, update us on how y'all are prepared. We know technically in that area there, but how are you prepared specifically to help younger patients with COVID-19 should they get diagnosed?
Sure. So I'll say as an organization, we began screening back in January at all points of entry. And I think screening is critical, identifying not only visitors and patients that are coming in, but screening our own staff as well. Within the unit, I'll say, building this unit back in 2015, it really put us on a heightened level on thinking about, as an organization, special isolation of patients who have highly infectious diseases. So it allowed us to be a little ahead of the game and prepared on how we would deal with any special disease like COVID-19 that would come our way. I'll say part of this unit, the unit itself is fancy and beautiful and very high tech, but we have a team of all volunteers, including nurses from all over the organization, physicians, respiratory therapists, even our lab personnel and housekeeping staff volunteers to be on this special isolation team. And we've trained for 5 years every 3 months in our PPE, or our personal protective equipment, which is the fancy biohazard suits that you see. We train as a team, we train on specialized protocols, and that's done every 3 months without fail for the past 5 years. So while I think the unit is incredible and what our organization has done to prepare across the board is great, I can't say enough about such a spectacular team of individuals who has stepped up to volunteer to take care of these patients. And that just goes a lot to say, I think, about how Texas Children has prepared for something such as this.
And I can imagine the preparations, as you mentioned, they've been underway for years to prepare for an event such as this. Dr. Arrington, there may be parents out there who are hearing that we might expect to see cases of COVID-19 go up. So describe to us how your unit is preparing in case you do see an influx of folks with COVID-19.
Sure. So, we're screening patients daily. We have the ability to now test in-house and send a COVID-19 PCR for patients who we are concerned may be infected. I'll say, looking at the data, children are doing much better across the board with this infection than our adults. If you look at data coming out of China, which is what we've been receiving now, it's about 2% of patients were under the age of 20. So for some reason, unclear about exactly why, children are either infected at a lower rate or asymptomatic or showing very mild symptoms as compared to adults. And then, adults, it's the adults specifically over 65 years of age with chronic health conditions that really need to be careful. But I think the data concerning children is very positive, but the key is hand hygiene, taking care of yourself, disinfecting your surfaces, staying indoors, isolating yourself if you are feeling ill, and isolating yourself from others who are ill.
Yeah, absolutely. Great advice. We did have, Dr. Arrington, a viewer ask a question about COVID-19, and we understand you don't have a crystal ball. None of us do. And Kenny was wondering, when will this all be over with? When do you foresee us peaking and for us to be in the past?
That's a great question. I do wish I had an answer. Most viruses, like flu, there are several other human coronaviruses that cause just a common cold. They are seasonal, so we'll see, for example, influenza should hopefully start to die down here in the next month. But it's difficult to say what COVID-19 will do until we really have that data. I would say absolutely be sure you have your flu shot and your vaccines are up to date. Have a good relationship with your pediatrician, and they're excellent to reach out to. But it's hard to say how long this will really go as far as community spread. And hopefully within a year and a half, we'll have a vaccine. That will be incredibly hopeful.
All right, Dr. Amy Arrington with Texas Children's Hospital, thank you so much for your time today.
Absolutely.
Stay safe. And in the meantime, Texas Children's Hospital will be with us all week long to answer your questions. So please visit our Houston Life Facebook page to submit your own questions.
And for more information on Texas Children's Hospital, you can go online to texaschildrenscoronavirus.org.